Coronavirus test online. Ukrainians are asked to accept the individual risks of having COVID-19 infection. To do this, one needs only to answer 28 short questions on a special website that altogether will help to estimate possible risks of being infected and collect the data regarding to the spread of infection in the whole country. These 28 questions cover not only the screening of the history of the disease or life, but also daily routine that can influence the patient. The environment, professional activities, being outside the house. This is such a balanced set of questions that helps not only to comply the bureaucratic norm, but also to look more broadly at the possible patient. The online testing was developed by volunteers from the Lviv IT company Beats Orchestra and the Celos Charitable Foundation. Its effectiveness has highly praised at the European Hackathon. Testing is considered as a screening tool that can help doctors identify the patients who are not at risk but believe they have symptoms of the disease. Basically, it's a screening tool that should be used at a pre-hospital stage, i.e. until the patient is admitted to the hospital, in order to reduce the burden on the medical professionals in terms of differential diagnosis. Another purpose of this test is to help users to understand their condition at the moment. And in turn, they will receive a personal result, with the probability of infection estimated in percents and a special action plan with the specific recommendations. At least 42,000 respondents have to do the online test to obtain representative data, after which the results will be sent to the Ministry of Healthcare for further processing. As for today, more than 17,000 respondents have identified their possibility of contracting COVID-19. About 1% of them belong to the so-called red risk zone. At the same time, the developers remind that the test is not equivalent to clinical assessment of the person's condition, so if the serious symptoms of the disease are present, the patient should immediately reach for medical attention.